Ray is a 65-year-old retired construction worker with osteoarthritis who's scheduled for hip surgery in 3 months. He tells his family doctor that since he's retired, his alcohol consumption has increased and he's been drinking 4 to 5 glasses of whiskey most days for the past 3 years. He said that while visiting family over the long weekend, he didn't drink for 3 days and was more irritable, nauseous, and experienced tremors along with a headache. He's worried about how he felt that weekend and is considering decreasing his alcohol use, especially with his upcoming surgery. Alcohol isn't just a concern for long-term health. People who drink multiple alcoholic beverages per day are also at higher risk of complications during and after surgery, such as infection, bleeding, or confusion. This is especially true for people who engage in risky drinking of 3 or more standard drinks per day or 21 drinks or more per week. One standard drink is a 12-ounce bottle of beer, a 1.5-ounce shot of hard liquor, or a 5-ounce glass of wine. Why are alcohol and surgery such a bad combination? Well, alcohol consumption can reduce heart and immune system function, prolong bleeding time, and increase the body's stress response. The less alcohol you drink before surgery, the better. It's best to avoid alcohol for at least 48 hours before your scheduled surgery, but it's even better if you can stop a week or two earlier than that. However, alcohol reduction needs to be done safely, and people with alcohol use disorder may require medical supervision for this. We've asked Dr. Leslie Martin to talk about minimizing alcohol consumption prior to undergoing surgery and why this is important. Dr. Martin is an assistant professor in the Department of Medicine at McMaster University and the director of the Internal Medicine Residency Program. Thank you so much for joining us today, Leslie. Let's talk about the difference between those who might drink socially or low-risk drinking versus those who may have higher risk drinking or alcohol use disorder. What are some of the implications there with respect to surgery?
I think this is particularly timely to discuss in light of changes that we've seen around alcohol consumption for Canadians in light of the COVID-19 pandemic. So there are people, about 25%, depending on the category, that have moved up their alcohol consumption and maybe now meet some higher risk criteria that they wouldn't have before, and others that in fact have reduced their alcohol intake. So I think understanding that difference is quite important as we talk about this. So a social or recreational drinker generally would have no habit or routine to which they would consume their alcohol and can live with or without it. And in general, we often look to those lower risk drinking guidelines to understand, on average, what somebody that would fall into the lower risk or social category might consume. And so for women, that would be 10 standard drinks per week, and for men, 15 standard drinks per week. The risk of injury we know increases when you're consuming 3 or more drinks within a given day or 21 drinks per week, and that kind of moves you into a higher risk drinking category. But that itself doesn't mean that you would meet criteria for what we would refer to now as alcohol use disorder. And that is outlined in what we call our DSM-5 criteria, or our Diagnostic and Statistical Manual for Mental Health Disorders, that defines alcohol use disorder. And in order to meet criteria for an alcohol use disorder, there's mild, moderate, and severe. And there's 11 specific criteria, which I won't take you through, but we often will think of what's called the 4 C's of addiction. And so that would be compulsion, cravings to continue to consume alcohol, starting to experience consequences from your alcohol consumption, and that could be difficulty meeting obligations at work or at home, rising social or interpersonal issues, use within hazardous situations, for example. So some of those consequences coming through, and then a loss of control over your pattern.
So it sounds like there's a spectrum from not drinking at all to maybe a more severe alcohol use disorder, and a pretty big range in between. Is there a particular level at which somebody would be, say, at higher risk for complications related to having a surgery?
I'll speak a little more to the study that informed some of this space. And in that study, they did use the higher risk thresholds when they were asking people about their consumption use. So, between 5 to 6 standard alcohol beverage per day or greater than 21 per week. So they used that rather than alcohol use disorder criteria. And that threshold certainly showed increased risk at the time and post-operatively.
So really
So that
people who
group
are,
meets the highest.
yeah, people who are drinking regularly and probably drinking, more than 3 standard drinks and closer to 5 standard drinks regularly would be the ones at the highest risk for some kind of complication.
Absolutely. That said, really, we don't have a perfect line in the sand, and really any amount of alcohol that you're drinking daily could affect your surgery as well as your recovery. And so decreasing the amount of alcohol that you are having in advance of your surgery, even if you don't meet those higher risk categories, could certainly have important impacts on your outcome.
So, what are some of the potential surgical complications for those who might be drinking excess alcohol in the days or weeks leading up to a surgery?
So I think when we're talking about surgical risks for alcohol consumption before your surgery, often we're talking about the increased risk associated with anesthesia. So general anesthesia is the sedating medications that will be provided at the time of your surgery, and those medications can affect your breathing, your heart rate, and your circulatory system. Alcohol intoxication, alcohol withdrawal similarly affects these systems. And often the medications are metabolized by your liver, as is alcohol. So there's lots of potential interactions that take place there. So this is why it's so critical that you would share with your physician about your alcohol consumption, particularly your surgeon and your anesthesiologist that's seeing you before your surgery. In part, this can have implications as well for informed consent if you're consuming alcohol right up until you're having that conversation. The risk of nausea, vomiting, and something going down the wrong way or aspiration could increase. I mentioned alcohol can interact with some of the medications, and so it can affect the metabolism, and sometimes you might need higher doses of medications to achieve adequate levels of sedation, or in other cases, lower doses of medications. So it can help your anesthesiologist adjust the dose if they understand your alcohol use leading into the surgery. And then as well, both anesthesia and alcohol can affect, as I mentioned, your heart, your blood pressure, your liver function. It would be important for them to understand the risks on your bone health, your blood cells, your nerve conditions, your cognition. So all sorts of potential implications for alcohol use, and a full spectrum of implications depending on the duration of your use and the amount that you consume. And then lastly, to make note of the increased risk of bleeding at the time of surgery.
So it sounds like it's incredibly important actually for people to let their doctors know. Sometimes it's a anesthesiologist who might be doing a preoperative assessment. You also do preoperative assessments. Do you find that people are honest and forthcoming about drinking, or is this a challenge as well?
I think there's a large spread. Obviously, we recognize that there is stigma that is associated with use of any substances, including alcohol. And so it really does depend on the individual and the trust that they've developed with the provider that they're seeing. And often these are one-off interactions. They're seeing you just once before your surgery, and then they might not even be the person delivering the anesthetic, for example, at the time of your surgery. So very different perhaps than your family physician that you have a rapport with in order for you to feel comfortable to share this information with this person that's meeting you just once. But it is so important that you do so.
So I guess if our advice to viewers would be, this is really important. Please be upfront with anybody who's assessing you before your surgery, and if you're a family or friend of somebody, it would also be information that you might want to share with the treatment team in that sense.
Absolutely.
So you spoke about some of the complications with surgery. What are some of the post-operative or post-surgical issues that can happen?
Yeah, so that's a great question. And there is some literature that informs this space. In 2018, there was a systematic review that looked at 140 patients from 3 different studies. And as I mentioned earlier, they included in these studies patients that were using high higher amounts of alcohol, so about 5 to 6 drinks per day and over 20 per week, that were undergoing a range of different surgical procedures. And they did a number of different interventions to support patients around abstinence after their surgery, and followed them for somewhere between 4 weeks and 3 months to understand the outcomes in this patient population. And they did find a significant reduction in complications of surgery. And so some of those complications are ones I referred to with your last question around bleeding. But as well, they did find reduced post-operative infections, surgical site concerns, reduced confusion in the post-operative setting. There was a reduction in concerns that arose around the heart function or the need for a more supported care environment like an ICU in the intensive alcohol treatment group in comparison to the control group. Overall, the quality of this evidence was ranked as moderate because it's a relatively small group of patients at 140 patients, but certainly it's the best evidence that we have at this time to inform the space. Sorry, go ahead.
You and I probably both see so many patients who develop an alcohol withdrawal delirium, and even people who have maybe been drinking regularly, but because they've been drinking readily, they may not even be aware that they are at risk for a delirium. But I don't know what you see most commonly, but our experience is very similar to the findings from that study in terms of the types of complications.
Absolutely. And it can be very difficult if the full history was not documented up front to identify why somebody is confused at the time after they've gone through a surgery because they're coming out of anesthetic. Maybe they also have an infection that you'd be worried about, and that could be causing the heart rate to be up and for them to be confused. And alcohol withdrawal would present similarly. So it does present a bit of a diagnostic dilemma if it hasn't been documented that somebody is meeting those high-risk alcohol consumption criteria before the surgery, and then afterwards, if they're confused, they can't share that with you. And so I have seen times not only where it's presenting or contributing to their presentation, but where there's a diagnostic dilemma and a delay in treatment because it wasn't documented adequately before the surgery.
Yeah, the type of treatment that we might use for alcohol withdrawal delirium would not be used for other complications like infection. So again, really highlights the importance of talking with the treatment team in advance so you can plan ahead. So you spoke a little bit about there's a little bit of research evidence to support things. So how would you safely support alcohol reduction before surgery, and what kind of advice would you have for Ray, who we described up front?
So I think that's the most important part of our discussion for today. If you're hearing this and you're thinking, should I reduce my alcohol before my surgery? We want to make sure that you're doing so safely. And so the first thing I would suggest is speaking with your physician, and that could be your surgeon, it could be your family physician, somebody that you trust, about how could you reduce or discontinue alcohol safely. I think if you're meeting the low risk drinking guidelines and you're having, 10 for women and 14 to 15 standard drinks per week for men, you could very safely, just go to 1 drink a day and then entirely abstain and be safe to do so. However, if you're drinking, more over a long-standing period of time and greater quantities of alcohol, you could be at risk to develop alcohol withdrawal while doing a reduction, or if you entirely abstained and entirely cut it out. So people might experience withdrawal symptoms somewhere between 6 hours to 48 hours after discontinuation of alcohol if they are at risk to develop some of those symptoms, like Ray. Ray described experiencing a number of those symptoms. So things to watch for would be anxiety, irritability, tremors, nausea, vomiting, sweating, and more severely, hallucinations, confusion, and seizures. Like Ray in this case, who was experiencing mild symptoms, we wouldn't want him doing this on his own, and we want him to be involving the physician and deciding whether it's safe to do a reduction with or without medication supported by your physician at home. For anyone that consumes larger quantities of alcohol and is at risk for complicated withdrawal, that should be done in an inpatient setting where they can be monitored and provided medications to reduce the potential severe consequences like hallucinations, seizures, or death from alcohol withdrawal. So that would be my biggest thing, is to first speak with your physician. They can help you understand your risk with the reduction of alcohol, and then figure out the best place to meet your needs in reducing your alcohol before your surgery. And if you are open to tapering, and you're just going to reduce a little bit, it would be safe to reduce generally by about 1 alcoholic beverage per day as a place to start.
And yeah, just I think that's a great message, that if you're at the higher risk, if you're drinking more, if you have an alcohol use disorder, abruptly stopping is likely medically unsafe. So you should absolutely work with your healthcare team to safely reduce your drinking before surgery. If you're in the lower risk range, then you can likely either taper fairly quickly, a few weeks before surgery, or just stop abruptly. And if you're at the lowest risk range and drink infrequently, you could probably do that safely, and there'd be some merit in doing it.
Absolutely. And the last thing I wanted to mention is there are medications that are available to be prescribed by your family physician or by somebody with more experience to help support cravings around the use of alcohol, and to reduce heavy drinking days and support abstinence, depending on what your goals are. And certainly that could be, some of those medications could be safely initiated either before or after surgery, depending on the medication. So that could be something that you could explore with your physicians as well.
So it sounds like with higher risk drinking or alcohol use disorder, some advanced planning around the issue before your surgery would be highly beneficial in terms of the overall surgical outcome, the post-operative outcome, and probably longer term for your health and well-being as well.